Whakatako te hau ki te uru. Whakatako te hau ki te tonga. Kia mākine kine ki uta, kia mā taratara ki tai. E hi ake ana te atakura. He tio, he huka, he hauhu, ti hei Māori ora. Ko wau itu akane, ko waka rererangi o Afrika ki te tongata waka. Ka whana mai au I raro, te maramaru o Togomoanga ko te tipu. Ko Sandflay te moana, ko tuakau kei te noho ahau, ko rutunui toku Haere mā, welcome everyone to our another episode of the New Zealand Telehealth Leadership Group's webinars. It's a pleasure to have you all here. I'm going to sit in the background of this webinar, and I'm going to hand over hosting rights to Mary Lossy, who will lead us through a fantastic webinar. Thank you, Mary.
Kia ora Ruth, he mihi tēnei ki a koe te rangatira Dr. Nui, tēnā koe. Kia ora whānau, ko Mary Lossy toko ingoa, ko rere ahu ki Ngāti Mani o Poto, ko Ngāti Pākehā o ko iwi I te mama, ko tunga tapu ki Microaggressions I te papa hoki, he mihi tēnei ki a koutou, ko whakaro tātou, ko whakatau tātou, te wā ki te mahi, te wā ko harama ki te tautoko ki te iwi. No reira, tēnā koutou, tēnā rā tātou katoa. Good evening, everyone. Welcome. I hope you're all safe and well from wherever you may be joining us. I'm Mary Lossy, Chief Customer Experience Officer at Whakarongorau, Aotearoa, New Zealand Telehealth Services. We have a stellar panel joining us to kōrero this evening on improving Māori health gains. And with the reforms and the establishment of the Māori Health Authority, it is a timely discussion point. Let's whakawhanaungatanga, wahine mā, no mai, haere mai. Kōrero mai, tēnā koe Jade.
Kia ora e hoa, kia ora mai tātou, ko Jade Chase toko ingoa, no Ngāti Tūwhare tō me Ngāti Piti Kaupeka ahau, kei manatu hauora Māori Health Directorate ahau e mahi ana, he Chief Advisor pai ora taku tūranga mahi, no reira tēnā no tātou katoa. So Chief Advisor pai ora in the Māori Health Directorate within the Ministry of Health. It's awesome to be here today and I'm looking forward to engaging with you all.
Tēnā koe e hoa, kia ora Lilly.
Tēnā koutou katoa e whakarongo mai nei. He uri ahau no kaitahu, ara no pokitaraki no o tākou hoki. Hui anō he tāku tahau e mahi ana ki tāmaki makaurau ki Turuki healthcare ki roto I a māngere ki te taitonga.
Tēnā
koutou. Dr. Lilly Fraser there from Naitahu and working at Turuki Healthcare in Māngere. I'm a GP and clinical director.
Tēnā koe Lilly. Kia ora Sasha.
Kia ora koutou, ko Sasha Webb toko ingoa, no ngā pui ki Ngāti Kahu ki Pākehā hau. E tipo ake au ki whangarei, engari nai nei e noho ana au ki te whanganui a Tara. He te aho o te Kahu Cancer Control Agency, ki, te mahi ana, he kaiwhakahaere kaupapa mana taurite, Senior Project Manager Equity, longest title in the world, aho. Awesome to be with you. Kia ora.
Kia ora Sasha. Tēnā koe Mataroria.
Kia ora tātou katoa I roto I ngā taumahatanga o te wā, no reira ka piki te ora te kaha kia tātou o te rā I runga I te motu ka mihi atu tēnei kia korua hoki ngā kaiwhakahaere, Ruth rāua ko Mary. Koutou hoki ngā kai kōrero, ngā rangatira tēnā koutou katoa. Ko Mataroria tōku ingoa, he uri ahau no Ngāti Hene, Ngāti Whātua, Ngāti Wai me Waikato, he rata ahau ki Telehealth ki Tamaki, me mahitahi hauora ki te tai tokero. He mahi anō ko nā he kākoa ahau ki te whare wānanga o Tamaki Makaurau hoki nō reira kei te mihi. Kia ora everyone, my name's Mataroria, I'm Clinical Director at Telehealth and Equity Lead at Mahitahi Hauora, the Northland PHO. And also Senior Lecturer in Clinical Education at the University of Auckland. Kia ora tātou.
Tēnā koe e hoa. Kia ora Bernard.
Nā tātou katoa, ko koutou e titiro mai ana, e whakarongo mai ana kia mātou nei, kei runga I tēnei poari kōrero I tēnei wā. He uri ahau no te taitokerau, te rāroa te au pauri ngā puhi Ngāti Whātua, te taho toku pāpa, taho toku māma Ngāti Koro ki Kahu Kurami Ngāti Mahanga Waikato tōku iwai. Nā reira ko bēne te pā tōku ingoa. He kaimahi hau I roto I te rōpū whakatū ai I te pūnaha hauora hau, ara ko te transition unit, ko au tētahi o nā kaimahi I roto I te rōpū Māori I reira. Nā reira I roto I tēnā tātou.
Kia ora hoa. Whānau, improving Māori health gains, it might be a good start to establish what that can mean. So I'm going to throw it to you, Lily. Tēnā koe. What do you reckon?
I think at a minimum we're going for equity, and anything above that is always optimal. So, at the moment we're seeing the real struggle in our vaccination rates for Maori, and so we've been having a lot of kōrero just today even around what other things can we do, because we know that those people that are, early adopters and keen to get it have had it, and so this is really where the mahi around getting our whānau vaccinated lies. And for me, it is really thinking about, what is the history? What does our past tell us around how we have got ourselves into this position where we're having major kōrero around distrust in the government, distrust in the medical services that we provide in Aotearoa, and then real, I think, genuine concern around something that's new. And then the need of it, because COVID hasn't been in our face in the way, thankfully, in the way that it has been in other whenua. So, I think that that's a really significant Māori health gain that we're faced with right now, that, needs a lot of mobilisation around the motu to be able to support our Māori whānau to get at least to that 90% rate. But higher is always better.
Kia ora, higher is always better. And sometimes when I think about the comparison rates of vaccination for our Pākehā population sitting around 50% fully immunised, fully vaccinated, our Asian communities around the same percentage, and Māori sitting at 28%. Sasha, you're nodding, what are your thoughts around vaccination or any other aspects of our health in terms of improving Māori health?
Well, I guess in the space I'm working in at the moment, our whānau Māori are 20% more likely to get cancer and twice as likely to die from it. And that's just not okay, and not in any sense of the word. So like Lily said, equity at a minimum is what we need to be going for in terms of Māori health gains. And that example is so typical across so many different areas of health and social systems.
Kia ora, Sasha. Jade, can I bring you in here, because equity at a minimum, the Māori Directorate is doing a lot of work up and down the motu across all of the DHBs relating to equity from whakamaua. What are you seeing from our clinicians and from community and whānau?
I guess it's clear that equity is an undisputed priority for the system. And whilst there has been quite a bit of progress in this area, there needs to be a conscious effort so that equity is the forefront of our thinking and our doing, particularly as we move into this new world that will be our future health system that Mataroria and Bernard is sorting for us. But I think it's important to be clear on what equity is and isn't. We used to use, back in the early 2000s, we used equality a lot, and we used to use equity and equality interchangeably. But as a ministry, we've got an official working definition of equity that we use, and I'll read it out because I think it's really important. It says that in Aotearoa, New Zealand, people have differences in health that are not only avoidable but unfair and unjust. Equity recognises different people with different levels of advantage require different approaches and resources to get equitable health outcomes. So if I consider what Māori health gain is, it's about having that conscious effort to ensure that we put the resource and effort into those areas that have been most underserved. And unfortunately, Māori, our Pasifika whānau and whānau who are most disadvantaged by the system, by an unfair system, are those groups that we need to focus on.
Kia ora, Jade. Mataroria, as a clinician yourself, you will have experienced a lot of inequity in your professional capacity. How does that play out in your mind, and what are the things that we can all join up on tonight to get some quick wins with our other clinicians who are watching, that just to grow that awareness and that you're conscious of your own thoughts to create the equitable behaviours we're needing for our whānau?
Ai tō pātai and I tautoko the kōrero so far. And I start with your first question about what is Māori health gains. And to me, it's oranga. It's te oranga o tō tātou nei koe me ngā kaumātua, ngā whānau me ngā tamariki me ngā mokopuna. So it's the aspiration that we have around the health and well-being of people, of whānau and of the next generation. Equity is a critical step towards that. But like Lily says, that's not the goal in itself, but rather it's around well-being and the health of whānau. And so when I think about some of the key drivers of inequity, and we've heard about the definition so far from Jade, we've heard about some of the history from Lily, I think for the purposes of tonight and for our audience, we can think of some of the starting points for inequity, particularly around the likes of within whānau and communities, around the differential access to the social determinants of health that impact on whānau populations. Secondly is about the differential access to healthcare. And within that includes both access to healthcare and the outcomes of healthcare as well. The third element is when it comes to the health workforce, and that relates to both underrepresentation of Māori within the health workforce, but also some of the health professional factors such as cultural safety. That is a critical part around contributing towards health equity as well. And lastly is around the health system itself, which I still see as much as a one-size-fits-all health system where it's not a level playing field, particularly for Māori, Pacific or other communities as well. And I know Bernard will speak more to that too. But starting off with some of the causes of inequity, and from there we can then look at, well, what are some of the opportunities around Māori health gains? And as Jade's talked about around the definition of equity, which I'll add, sits within te tiriti as a te tiriti principle, or the treaty as the tuapapa, te tiriti o Waitangi as the tuapapa, I see for Māori health gains. And so thinking about some of the potential solutions around Māori health gains that I see, and particularly from a clinical perspective, but also through the Telehealth Forum from a data and digital perspective as well, that I see as an opportunity across those different areas. But coming back to your question around some of the clinical aspects of it, I think we can all play a part in contributing to equity or actually being part of the problem as well. And so whether we be a receptionist, a practice manager, a clinician, funding and planning, or a policy or strategy person, we all actually have to reflect on how we can contribute in our own mahi, in our own roles, and in the decisions that we make day to day, both clinically or within non-clinical roles as well. And so I see that as part of the challenge ahead, but also the role that we can all play, not just Māori being responsible for Māori health gains or the Māori Health Authority, but whether it be within the care that we provide. And so one opportunity for that, and I think Lily will be able to comment on this too, is around the care that we provide. Is it best practice? Are we contributing towards equitable outcomes, particularly for patients where we know from Jade's definition that we need to take differential approaches, differential services, differential resourcing and solutions in order to contribute towards equitable health gains? And just my last point that Lily mentioned as well, we've seen that through COVID, where we need to move away from designing solutions for communities to be actually designing solutions with communities, or even better, is to be able to enable communities to design solutions for themselves. And so I see that as a critical way also around contributing towards Māori health gains. So I thought I'd just start there around some of the drivers, around some of the opportunities and the role that we all have to play within to contribute towards Māori health gains.
Bernard, just to pick up with you, and from Mataroria, everybody has a role to play, and certainly the transition unit has a very big role to play in moving forward. Can you share some of your thoughts and whakaaro around this kaupapa in relation to the mahi that you're doing currently?
Yeah, kia ora no tātou. Look, I think one of the things that we have to remember around Māori health gains and health equity is that for Māori, it actually starts with ensuring that our tiriti obligations are clearly outlined and there are pathways to meet those obligations. You know, recently the findings of the Y2575 report outlined for us 5 clear principles which sit as a baseline for us in terms of what are the obligations that the health system needs to be looking to address when it's looking at how it delivers best services to Māori as well as to the rest of the population. So that's really underpinning. I think the other part is when we looked at what needed to be redesigned in the health system on the back of the Simpson report, and in particular the work that was done by the Māori Expert Advisor Group inside of there, it was very clear that while we use the Te Tiriti o Waitangi to underpin the work, that actually we had to look at equity from all its particular parts, from equity of access to equity of service delivery and access to services to equity of outcomes. So, you know, that they're pretty simple tenets, you know, under which we can start to look at how we begin to work at ensuring that Māori have the same level of health as every other population group. So I think that's first and foremost. I think the second part and really key to the work that we've been involved in is how it is that you ensure that Māori are engaged in the system itself at all different levels. And, you know, while debates will continue to go on for a wee while in that, I think it's important that we look at Māori's inclusion and engagement in discussions, in co-designs, in decision-making where that's appropriate, at all levels, not just at one particular level or at one particular area. So, you know, the establishment of the Māori Health Authority, as it's currently called, and the appointment of Māori into the Health New Zealand board sort of indicates that the intent is to make sure that the Māori voice is heard right across the whole system, not in a particular part of it. And I think that's what we've got to remember is let's start both top down, but actually also bottom up in terms of Māori's involvement and engagement. So the last part to that is really the role of the iwi Māori partnership boards in working at localities, with actually its very first role being how does it engage with whānau out in communities to understand what their health needs are and what health gain, what good health looks like to them. And, you know, it's hard because, you know, we'll concentrate because we are health practitioners and we're interested in health. We'll concentrate on the health-related areas. But for our whānau, they're saying, look, you know, it's about being able to put nice kai on the table for our tamariki and our mokopuna. It's about living in a dry and warm house. It's about having an income and a job that helps me to feel like I'm contributing to the wider society and being a role model for my whānau. So, you know, health starts with a few of the things that we've got, but it's also starting to extend out, which, you know, huge challenges for all of us, but we wouldn't be on this call and listening on this call if we went up for it. So,
kia ora, Bernard, and the mahi ahead of us, it is big mahi. I'm just going to go to the chat, and Maxine's asking, do the panellists believe in the new Māori Health Authority, and is it a step in the right direction? Lily?
Yeah, I mean, I think we're at a point in the game where we have to absolutely 100% believe in it, right? I mean, this to me is a massive opportunity. And I think that if we are looking at, you know, what does mana motuhake mean? What does come out with our own solutions mean? Then I do really see massive potential in the Māori Health Authority. I'm really excited by who's been appointed to the board, and, you know, I'm feeling really hopeful at this stage in the game. And I think, you know, we have to be. And so, as they say, the proof is in the pudding, and this is a really long pudding to bake, you know, and so you're not going to, it's nice to get those short-term wins, but this is, you know, this is a long way down the track to really say what success looks like. But I think that, you know, everything that I hear, the intention, the whakaaro is really there. And so I'm feeling hopeful.
Yeah, absolutely. I was having a kōrero with some friends the other day, and I said to them, look, it's it's not the magic silver bullet that's going to solve everything. That's just going to start this year when we're dealing with how many decades of systemic racism really for our whānau. And so, Sasha, you were nodding again, so that's good. What are your thoughts on the Māori Health Authority?
I guess the solution lies in a bucket full of bullets. There is no one silver bullet, and so while the Māori Health Authority is an amazing step forward, it's not all on the Māori Health Authority. It's on everyone within the health and social kind of care systems to be able to take responsibility as well. So, and I guess the other thing I'd probably say is, I agree with Lily, this pudding is going to take a long time to bake, but we're heading in the right direction. And having the Māori Health Authority is not going to absolve Health NZ of their responsibilities to deliver as well. So I think I'm pleased to see that both organisations are focused on doing what they can to create system and transformation.
Mataroria, did you want to add anything around the MHA?
Firstly, as I've been privileged to be appointed to the Māori Health Authority board in the last week, he honore nui tēnei, he kaupapa whakahirahira tēnei, the Māori Health Authority, and a privilege to be appointed. And with co-chair Tipa Mahuta and Sharon Shea. Sharon and I had a webinar earlier today, and happy to share the link to that as part of kōrero around the Māori Health Authority too. But similar to our kai kōrero so far, this is a significant change, the biggest change in the last 20 years since DHBs around the health reforms, and particularly around the establishment of a Māori Health Authority to work in partnership with Health NZ. That is part of the Te Tiriti kaupapa around partnership, but also around tino rangatiratanga and greater control and decision-making around kaupapa Māori services in particular, but also co-commissioning with Health NZ as well. And while we have yet to have our first board meeting coming, in my own personal view and capacity, very much see this as critical enabler, firstly around trying to prioritise, fund and develop new services, kaupapa Māori services, mātauranga Māori services, as well as trying to increase the Māori health workforce, which is an important goal to me and others on the panel as well, and particularly around trying to improve access to health services, trying to lower costs for whānau, as well as waiting time. So I thought I'd just add that that's some important kaupapa to me, and in particular around taking a life course approach for our hapumama tamariki and our rangatahi as well. And so that's just some of the kōrero that I'll be taking to the Māori Health Authority board table as well. Kia ora tātou.
Kia ora. Jade, your thoughts on...
I agree with everything that's been said, and congratulations, Mataroria, you're going to be a real asset to that kaupapa. I guess I'm really cautiously optimistic, cautious in the fact that the health system is really complex. We've got long-standing pain points across our system, which tends to default, particularly under pressure, towards decisions without an active consideration of equity and totality. So I'm optimistic that the Māori Health Authority adds an additional layer of accountability on the system. But I guess the question I have is, like, how might we embed pro-equity and totality-centric thinking, practice and behaviour in a way that will produce real impact to real people at scale, and that responsibility of Māori health gain doesn't just, and I think you alluded to this, Sasha, earlier, doesn't just sit with the Māori Health Authority. Everyone who works in the system has a responsibility to contribute to equity and honour obligations under totality. So that's the cautious part. So I think, I am really excited, and I'm really looking forward as working as a Kaitake Ministry in the system, that working alongside the Māori Health Authority, Health NZ, and the other structures that we set up to see what we can do together. And I'm looking forward to working more deeply in partnership with our tangata whenua of our people, and working at the grassroots to design solutions that will work for them. So that's me. I'd say I'm cautiously optimistic.
Hi, kia ora. And equity is coming up thematically in the chat as well. And we've got, as healthcare workers, we are largely exposed to the goals of equity for the Māori population. What do the panellists believe is the first step to achieving the goal of achieving a minimum of equity? We kind of touched on it, but maybe some short, sharp, succinct sound bites, steps to achieving the goal of minimum of equity. Lily.
So I think that, the kupu whakawhanaungatanga really underpins a lot of Te Ao Māori in terms of, the connection that we feel with people, the connection that we feel with whenua and with the taiao, they all come together. And so I think when we're looking in a tangible way, what does that look like in practice? Some of it's really, really simple. Simple, but not necessarily easy to execute. And so really things like pronunciation of names. And I'm sure something Mataroria has experienced a lot through his name, his life is this beautiful long Maori name that, actually from the outset, mispronouncing that, you've got that microaggression of just, here we go again, and you've already started on the back foot. You're now going to have to make up ground. And so I feel like so much effort has been put into Te Reo Māori. There are so many resources out there that I think we all hold an individual responsibility to commit to correct pronunciation of Māori names at a minimum. And then I think, if you're looking around your practice, what is it about your practice that says this is a place where Māori are welcome and where you belong, and we want to help you walk beside you. Te mea. So what is it in the imagery? What is it in the names that you use? What is it in the staff that reflect Māori, that make Māori feel like this is a place, their place, as well as everybody else's place? So I think, those really just little tweaks that you can very quickly pick up that can make just the experience of walking into your practice that much more relational for Māori. I think the quality is, number one, there's quality, because, we were having this kōrero today that my young GPs that come through Turuki are phenomenal. They're really guideline driven. If they don't know something, they know how to look it up. They know where to find the information, and they're always asking questions. And I think the older we're in the game, the more complacent we get, and we can, we can slip in terms of keeping up with the current practice or how we access things. And so I think that continuous commitment to quality is really important. And then I think it's learning more around Te Ao Māori and hauora, Māori models of health, and that this is not just a physical or a mental component of health, that Māori worldview of health is really much more than that. And not that I expect every service to have wairua practitioners or work with mātauranga Māori, but know that information is really important, and know what's available in your own community, particularly virtually. There's so much online now that we can utilise in our day-to-day practice. I'm forever sending text links when I'm doing my virtual consults. I'm sending a text link to a rokoroa meditation. Some maramataka workshops, just little things that keep us in that well-being space. So I think it is being creative, and there's a lot of resource out there.
Sasha, Todd's asked a question around, as a non-Māori clinician who's just recently moved to New Zealand from overseas, what role can I play to help the Māori voice be heard and to support equity?
Kia ora, Todd. I guess it can sound trite, but the kind of thing that I try to think about in my day-to-day work, albeit that I'm a policy geek, is what I'm doing mana enhancing for the communities I work with and for. And if you can think about as as you're working with your community, as you're getting to know your community, the importance of whakawhanaungatanga, the importance of recognising the importance of whānau to a patient, because it is not just about that one person that you might see in your practice, it's about the whānau that they sit within. Those are probably sort of the key things that jump out at me initially.
Oh, kia ora. Kia ora, Sasha. Mataroria, we've got a question around telehealth helps but may need a service, whether it be an iwi provider to help with travel, to help whānau and to support with online consults with GP and practices, and with COVID that we can deliver the services. What are you seeing in your practice around COVID for whānau?
Oh, good question. And following on from the question to Lily as well about what are some opportunities around things that could be done to improve Māori healthcare. And I think telehealth is one of those opportunities, thinking about the Telehealth Forum and describing that, particularly around data and digital opportunities. Your question specifically around COVID, we've seen a huge move over the last 18 months, not only into telehealth, but also around mobile and outreach as well. So we've seen a need to move beyond waiting for patients and whānau to come to the service, and the service needing to go out into the community, whether that be for testing, whether that be for COVID vaccination. And so we've seen the use of outreach and mobile approaches, which Māori health providers have been doing, for a long time before COVID, but very much coming to the fore now. And so in particular around the move to telehealth through the College of GPs, for example, and in secondary care as well. During Alert Level 4, 90% of consults being conducted online. Level 3, about 70% needing to be conducted online, not only around protecting whānau coming into the practice, but also the health workforce as well. And so that's been a big shift. But I think a needed shift as well in terms of providing options for access, whether that be through mobile or outreach, or whether that be through telehealth and online. And I think it provides more options. So it's not for everybody. We need to have choices on how whānau access care. But I think COVID's shown how there can be a much more choice to access care now. In terms of data and digital and telehealth in particular as well, I think being able to access care through online channels is a good thing. I think it needs to be here to stay and also increase as well. But acknowledging that we do need to also provide in-person care when clinically needed for physical exams, for services, cervical screening, immunisation, etc. But I hope that hope to see more of that mixed model that continues, because I think last year, after some of the first lockdowns, a lot of services then went back to BAU, but rather trying to build on the models that we've seen come through that work well for whānau, and having a lot more options around how whānau access care, I think it is a really good thing.
Ai, kia ora. Bernard, Andrew's asking that telehealth and digital-enabled health services can help with many challenges the health system faces, for example, improving access for some, but there is a risk that some will be disadvantaged with poor access to connectivity, devices or digital literacy. Any comments on how we think about this challenge? Kia ora, Bernard.
Look, that's a challenge that in particular affects a number of our rural populations. I think, part of the redesign of the health system is to apply pressure on other parts, other systems, to ensure that actually accessibility is, I suppose, made our priority and made as simple and easy as possible. I think the other thing alongside of the sort of a telehealth and digital perspectives is actually how is it that we grow those services in those areas so that our whānau's own information is available to them on the phone, just like how they access Facebook or Instagram or what have you, in a manner that helps them to understand their own health and well-being. I think Jade was saying that, we've got a very complex system that we work in, and we want to be able to be in a position where we can provide, test results. We want to be able to provide reminders that, your flu vaccination is due soon. Do you remember that you've got your COVID vaccination appointment coming up at such and such a time? We've got accessibility at the touch of our hands, but we have to try to make sure that it extends out into those sort of rural areas The other thing that I think is really important around this particular issue is that we start enabling some of our rangatahi to be the innovators in terms of what are our next areas for health development in that data and digital age. I mean, I'm pretty happy most days to be able to just answer a phone call, whereas maybe that's showing my own age. But when I have a look at the speed that my sons and their friends access their information, where it is that they do everything from finding out what healthy meals there are to cook to what exercises they're going to do that limits pressure on certain parts of their body and that because they've been injured there. If that's all at the touch of a few buttons, then how do we get our information and that we get through our health services made available and also help them to interpret that so that actually they understand the difference between really well-researched, well-thought-out information that they're accessing versus stuff that may not have the same level of rigour that's required for them to make good decisions. So great challenges, and I thought a really good question to ask.
Oh, kia ora, Bernard. I've got another question here from Maxine. And why is there a lower representation of Māori in the health workforce? Can Māori not access the same opportunities as Pākehā, or do Māori not want to move into this area because of the inequity? Jade, kia ora. What are your thoughts?
That's a big question and a complex issue.
Yeah.
Just before I answer that one, try to answer that question, just to the point around digital exclusion, which is what we were referring to before. I'm on a cross-government group which is looking at digital inclusion. What's really interesting is there are pockets of communities that telco refuse to put lines in. And so we can do all the mahi in building people's understanding and how to use devices and fund people's access to it. But if they don't have a line running in their community, it makes it very difficult for whānau to access those anywhere in their community. So one of the challenges and one of the things that we've identified as a notorious problem and something that we need to solve is how do we still ensure those people have access to services that are high quality in their communities if we cannot guarantee they have access to telehealth services. And as all these government departments are building platforms that are digitised, Work and Income's a prime example. You can't access things without going online now. Also within corrections, if whānau have home detention, often if they can't get a line in that community or they can't access it, they're sent to jail. So it has massive implications on the well-being of people beyond health. And so I think that that's something that I think it's the system has to solve that problem. And we have to ensure that if we are setting up these digital systems, that we're doing an equity and necessity analysis on the potential impact of doing so. And so it's considered at every point of that. So yeah, that was a really awesome question. And I might raise that question again to that cross-government group. But going back to the workforce thing, that's so complex. The pipeline's a bit broken. Let's be real. It's a bit broken. As I'm a midwife by background, in my studies, I started, there was 20 Māori in our Tihe Māori order stream. I was the only one to graduate. So we have an issue with the programs are delivered in the health system and retaining our whānau, but also ensuring that the curriculum caters to the unique needs of Māori, Pasifika, the different groups, indigeneity. And so there is a challenge there. Also, we know the social impact of people accessing things like education. Our education system is majorly flawed for particularly our Māori men. We haven't seen any gains for in education for our tāne Māori in mainstream. Yes, in kura kaupapa we have seen amazing gains there, but within mainstream continues to fail our young Māori men and many of our young wahine. So we have this issue where the system's failing here, one system's failing here, another system's failing here, and then the pipeline is hard to get into as a Māori. We have institutional racism that is rife throughout. And so a lot of the work I'm doing at the moment is actually unpacking our HR systems within the ministry and saying, where are the biggest blockers to getting more Māori and more diversity into the ministry, and what are the things that we can fix immediately, and what are the things we need to look at, embedding into our policy and ways of thinking and doing, and where are we recruiting from? If we're depending on certain networks that we go to, it will get the same kind of people. And I think this is a term you often use, Mary. The system is guilty in recruiting in its own image, and we definitely have that issue across the system right now. So there is a lot of mahi that's being done. I know there's going to be a lot of work that's going to fall out of Māori Health Authority and the work they're going to do. So Mataroria and Bernard might want to contribute to that, but it is a long-standing issue, and it's going to take more than one group of people to solve that one. We need to work with education, we need to work with the social system, we need to work with the associated bodies and those who are responsible for running those curriculum.
Well, kia ora e hoa. And, I definitely have an equity recruitment assessment framework that I'm happy to share with you and with anyone else. We created that. We overlaid it at Whakarongorau Aotearoa we overlaid on top of how we would normally recruit, and you could easily see where we weren't even going to the places where Māori and Pacific would potentially look for employment. Once they were in our system, we could see where they dropped off because we weren't looking after them. And we created a best experience. How might we attract and then retain the Māori workforce and build that pipeline for the future workforce that we would like to see? So happy to share that. Ronelle is asking around Māori youth experience significant health and social disparities in many communities and concerns with accessibility. This has improved with RN in schools. Do you think there is enough collaboration between local GP and local school health service and improving access and collaborating with school nurses to follow up with these young people? Great question. Lily.
So I think that's definitely one of the strengths of Turuki as a GP practice, is that we also hold the school-based health team for mana kids in the Māngere area. And it's amazing. It just means that there's a continuous collaboration between us. We see ourselves as all the same. So it's just another branch of our mahi, but it means that if they've got a query for us, we can, have a kōrero. And likewise, if we've got tamariki in the kura and we need to get that reach in to the whole whānau, then we can do back and forth. When we've had, tamariki with obesity, working with the school nurses, the school health workers to support the mahi that the whānau are wanting to implement around this tamaiti. It's so much easier when you've got, school's a big part of tamariki life, and having that input is really awesome. So yes, I think we also do the GPs in high schools in Māngere, and I've done that contract in the past, and I just see so many young rangatahi that I really don't think otherwise would have sought help, the support that they needed for their health. Not necessarily comfortable talking to their family about going to the GP, don't have the access to get to their own family doctor, but having it in school means that they, can get it so quickly, confidentially. And I think it's a great service.
Kia ora. Sasha, Janine's got this question that I think you'll be really interested in answering. How do you think accountability to Māori health gain should be measured outside of meeting government set targets? And do you support disinvestment in services about not making gains?
Damn, we're not pulling any punches tonight, are we?
Go for it.
I guess for me, accountability, the accountability measures and mechanisms need to be built in partnership. So it's not just about them being set by one organisation or one sector. but how do we build in the voice of lived experience? How do we build in the insights that we gain from patients and whānau who've been through our services? And what does that then change in terms of our accountability mechanisms and measures? I think for too long now we have not elevated the expertise that comes with lived experience in our health system, but in so many different areas of our lives, and that is going to be critical, I think, going forward.
Kia ora. Mataroria, did you want to add? And I saw you looking very energised by that question.
I love these last three questions, actually. We could talk all night about workforce in itself, and then Lily's question around school and outreach, and this question as well around measurement and indicators. And I think those happen on multiple levels, and we've seen the most recent framework come out, actually, from the Minister around the new health system performance framework and the associated measures with that. But secondly, thinking about in our own day-to-day mahi as clinicians as well, what are the clinical quality measures that we use as well, but also thinking around how is it that we have actually, as Sasha pointed out as well, around whānau measures and indicators that are co-designed and around measures that actually matter to them versus the health system. And lastly is also about needing to measure what matters versus what we can easily measure, which tends to be the case. We measure ASH rates for decades because we've got those data sets. And I hope with the new data and digital elements of the reforms, not only are we building kaupapa Māori evidence, but also around more sophisticated ways of using our existing data sets and more sophisticated means of analysis as well, thinking about natural language processing and all the new data methodology and analytical tools that we have as well. So I think to round out is around thinking about the different types of measurement that we do need at different levels, health system, health providers, clinicians, whānau and community as well would be some of my suggestions around how we measure what actually matters.
Just a couple of things to add in there. Look, one of the key functions that have been added into the new health system through both the Māori Health Authority and the Iwi Māori Partnership Boards is identifying the whānau voices who can tell us about what services are required, but also how those services are performing. And one of the things that I think we've had to learn as a system is that we spend a lot of time reflecting what we think whānau are saying about our services, whereas actually we probably just need to go directly to them and start having those engagements with them, which asks, simply says, how have you found our service? How have you been able to access our service? Are there ways that we can improve our service? And, the flow-on effect of that is that our whānau will start to own the services that they're accessing. And if they're able to own those services, then we start getting better uptake and greater trust in our services. So I think the other measurement has to be the measurement that comes from listening to our people.
And I imagine too is what we're measuring, right, and how we're asking those measurements to tell that story and to capture the narrative that really serve whānau. And Manisha's got a great question, just building on what you just said, Bernard, around trust. Any further ideas, panellists, on how we can build trust in the health system for Māori? What a great question. Jade.
Stop stuffing it up. So this is a system. I mean, I think, at every level of the system, there's good things and then there's bad things, right? There's good practice and bad practice. I saw a question answer about, meeting halfway. Surely there's a halfway point where Māori can come into the service as well as us serving Māori in different ways. I think the challenge with that is there has been mistrust, not just of the health system, but the system that is what we have today. historical stuff that, yes, it happened a while ago, but it's still impacting Māori today. We've inherited the trauma from our ancestors and our tupuna. We continue to feel the pain of losing our land and our resource. We still hear the stories of what happened to our nannies and our korors and our great korors and nannies and the pain that existed. And so there is this mistrust. I think as soon as, if people can start seeing our genuine commitment to Tiriti and honouring those obligations, I think that's a good start. But it has to be shown through action. We can't just write about it, create frameworks, create plans. People want to see us delivering on it. I guess I'm talking from a Kaitake in the ministry point of view. They want to see us deliver on equity and be true to what we're saying we're going to do. And I guess our clinicians can speak from the, at the coalface and what the challenges are there. But I think we just need to start delivering on it. And here's our opportunity. Māori Health Authority, new system. Let's really gear up and get it right this time to build that trust with our Māori communities.
Jade, there's a lot of campaigns that go out, etc., and particularly around the COVID vaccination space here at Whakarongorau, Aotearoa. Some of the insights that we're receiving from whānau is that the hesitancy doesn't necessarily sit with clinical hesitancy. It can also sit with the fact that I'm hesitant to go and get a vaccination because I do not want to go as an individual. I want to go with my whānau, and I'd like to go to a Māori vac site as well. So in many ways, some of the things in the ways in which we are applying our knowledge and having a much more whānau construct and approach to the provision and service for whānau is going to make that change. And I guess I'm challenging all of us to think differently, even though we probably are thinking a little bit differently to the mainstream of the health system. What can we do as panellists here and the mahi that we're doing every day? What can we commit to tonight to making that change? Lily?
This might not be overnight, but I do think that we really need to look at our model of care and acknowledge that the 15-minute consult, and in some cases the 7-minute consult, aren't going to work when you're trying to develop trust. And that, that's something at Turuki that we've been really making changes in the last 12 months, is that we've moved to longer consultations. We are luckily able to access wellness consults. That means that we can do even longer than that. How do we support whānau with, mental health problems that need, that 15 minutes is just really never going to provide the support they need. And is a GP actually who they need at all? And so who is it in your team? One of the really cool things that we've done in the last 12 months is starting with health coaches, and the health improvements that they achieve, they are phenomenal. And they come nowhere near what I can do with drugs. That we can't underestimate those small, frequent chipping away at goals, the long-term relationship, the ease. Is it a text? Is it a Facebook? How are you communicating with each other? That's normal. That just makes you part of their life. You're not kind of separate from them. You do become part of their whānau. So I think that that's really important as well. But also that bringing back to that, the te taha wairua, that we really can't remove that. And, I was saying today, one of my whānau members, her HbA1c has come down to 50 from 120 over the last 6 years. And really the only thing that's changed is she's got her kids back. She's got her own house, and she's just got a job. Now, what have I done? Well, I've walked beside her and she trusts me, but she's on less medication now than she was before. That there's this so much more to health and well-being than what we can prescribe. And so 15 minutes or the people that we're offering aren't going to cut it.
Sasha, what can we do? How can we help our Pākehā colleagues to understand, to be more empathetic to our Māori equity needs and meeting those unmet needs?
The blunt side of me wants to say we can do that by encouraging and gently or not so gently pushing our Pākehā colleagues to go and sit with Māori, in their community, listen to them, find out what it's like to live a day, a week, a month in their shoes, understand their lived realities, understand the context that they live in, as opposed to the clinical issue that they may be focused on as a Pākehā clinician when that patient walks through the door. Understand the whole of the person, and that doesn't come easily. It involves time and commitment on the part of our Pākehā clinicians.
Oh, kia ora, Sasha. Mataroria, a question here is, I'm continually surprised at my Pākehā clinicians' inability to recognise the barriers that Māori face when accessing health services, i.e. one is acknowledgement of racism as a significant contributor of poor health if Māori, structural, institutional or interpersonal. How do we change this, and what can Pākehā clinicians do to see their own privilege, acknowledge racism and bias in our health system? No wonder it's an anonymous question. That is a quadruple-barreled loaded question.
And some of it's actually been answered through the kōrero so far with Jade, Sasha and Lilly as well. The vast majority of Māori don't see Māori health professionals. We need the non-Māori allies, whether that be at the board table of Health NZ, whether that be within the clinical services as well. And so having non-Māori allies, pro-equity people is an important part around Māori health gains too. So coming back to your specific question about institutional racism, unconscious bias, I've seen some of the questions so far where Pākehā are actually really open and wanting to learn more. And that's a critical step in itself in the first place. But the next step is, what are you going to do about it next, beyond the webinar, for example? And there's a whole heap of different resources that are available. We've got record numbers of Pākehā taking te reo courses, for example, now, and emerging interest in te ao Māori and tikanga. So starting off with actually upskilling yourself is a really good first step, because there is different resources out there, starting with an open mind and wanting to learn. And some of that is also around specific professional development that needs to happen within colleges and within the health system, beyond kind of what might be a bit patchy, depending on which clinician or college you're involved in, and this is from a medical perspective as well. So part of it is also around the health system structure and training processes, which is what Jade previously touched on a wee bit as well, coming through the pipeline in order to be able to build hauora Māori within curricula as well as part of that. So it's both system level, it's both within training level, but also on an individual level as well, around the responsibility to be able to be proactive around trying to, as Sasha's said it as well, understanding Māori realities, but also being able to do professional development, which is available for individual clinicians as well in terms of their clinical practice. And just to round out in terms of that trust question, trust is built at the system level, and that's part of the challenge at the moment with the COVID vaccine rollout, for example. Trust is built within providers and services like the likes of Turuki Health, who are doing amazing mahi across different services, but it's also developed at the individual level as well. Call it whanaungatanga or call it rapport building, but there's individual whanaungatanga that you have with your patients or with the in the mahi that you do is also a critical step in rebuilding trust or developing that trust with your patients, which then reflects on the service, which then reflects on the health system as well.
Kia ora. Whānau, I'm just mindful of the time. We've got like literally 1 minute to go, so I thought that I might just get some final comments from our panellists. And before I do that, I'm just sort of thematically, what we've been talking about this evening is, equity at a minimum. The changes are a system change that's required. Workforce, building that capacity and capability with our rangatahi to bring them through the pipeline. So we've got a stronger and more capacity for Māori workforce, and for our Pākehā clinicians to understand Māori as whole people, our belief system and as whānau and the constructs and the operations that we as whānau, how we operate, and enablement, elevate our mahi, and to establish equity and embed it. Lots of E words. So I'm going to give everybody an even amount of time to have their final comments. I'll start with who's up on the screen first, and that's Dr. Lilly Fraser. Tena koe hoa.
Oh, yeah. No massive final words, just kia kahara koutou. I just commend you for coming tonight, and I think that's a really cool sign that 161 people are here. Have a listen. Ko Māori.
Kia ora, Lily. Kia ora, Sasha.
I would love to see people fundamentally challenging all of the current assumptions that they have, and the current, some of what you think is knowledge is probably assumption and bias. And so it's hard for us to do that to ourselves. And so support your colleagues to have those courageous conversations. Particularly support the Māori colleagues that you have among your staff, because there's so few of us. And we need to tautoko them as much as we can. And just be, I just about said be kind to each other. Always be asking the question, what can I do better for whānau Māori?
Oh, kia ora, tēnā koe. Kia ora, Bernard.
Kia ora tātou. Well, 2 points. First point is let's listen to the voice of our whānau, engage with them, and allow them to be engaged with you. And in the words of the great Tai Tokerau prophet, emancipate yourself from mental slavery. None but ourselves can free our mind. Kia ora.
Kia ora. Tēnā koe Mataroria.
Kia ora koutou. I'm just going to come back to the 4 points that I raised early on in my first kōrero, thinking about how is it that we can all be an advocate in our day-to-day mahi around tackling the social determinants of health that disproportionately impact on Māori. Secondly is about how can we improve access to care, and that might be within our clinical work and the way in which we engage with whānau, or it might be in the designing of services as well, around trying to address some of those barriers. Third thing is about how is it that we can improve what we've talked about around the health workforce, not only around increasing Māori within the health workforce, but also for our non-Māori colleagues and allies as well, and being supportive, like Sasha said, around bringing through more Māori and in the way in which we can provide care, or non-Māori provide care to their patients as well. And lastly, around the health system factors as well, which I see as a huge opportunity ahead of us with the health reforms and with the opportunity of the Māori Health Authority as well, and technology and data and digital in terms of the scope up of the Telehealth Forum being a critical enabler across all of those. So thank you very much. This is the starting point of this kōrero, perhaps for many, and I encourage you beyond this webinar as well to be able to look for further opportunities around professional development for Māori health equity. There's plenty out there, and I'm sure all of us across our expertise of clinical, of policy, of health leadership, really thank you for coming tonight and being open to this kōrero around Māori health gains.
Kia ora hoa. Jade, tēnā koe.
Tautoko all the final comments, and I've just got these cards here that we created for the in the ministry when doing equity planning. You can't really see them, sorry, but they're how might we cards. I just want to read out two of them that stood out from tonight. How might we build a system that is more agile and intuitive to the health needs and aspirations of Māori? And how might we stay connected to the realities on the ground, particularly for those with lived experience, which talks to what Sasha, Mataroria and Lilly were saying. So I guess we should be asking ourselves all the time, how do we hold ourselves accountable for our role in achieving equity and honouring our tiriti obligations? And by asking those questions, how might we, opens the door to opportunity that there is opportunity for us to shift and change. So just want to thank everyone and the beautiful panel and the awesome questions, and also your hosting, Mary.
Kia ora e hoa. Well, thank you, everybody. And I can actually, if you want to have more information, you can go to the website, www.telehealth.org.nz. How might we continue all of this? Another webinar, just always staying connected, whakawhanaungatanga, sharing the whakaaro, sharing what we know and sharing what we do every day in order to enhance and improve our health gains for whānau. Thank you for everybody online for joining us this evening. Thank you to our panellists. What an awesome kōrero. I'll just finish off with a karakia. E te atua, whakawāte te noi a mātou, whakawāte te hauota i rongi a mātou, whakawāte te taureka-rekatanga i rongi a mātou, kia maranga mai au ki runga, uie, tae ki e. Mai marere.